What's going on, guys? Tony here. So in this video, I want to review a Medicare EOB so that you guys understand exactly what you're looking at, because one of the main questions I get, especially this time of year, January, February, even into March, is how do I know if the patient's deductible has been met? How do I know when I need to collect from the patient, how much I need to collect, and so on. So behind me on the screen, I know it's a little bit fuzzy, but that's okay. You guys can see, starting with the far left hand side of the screen, you can see the service start date and the service end date. And remember, if you're doing physical therapy, occupational therapy, speech language pathology, each visit can only span 1 day. So your to and from date have to match. You cannot submit a claim for a date of service spanning more than 1 day. It has to be 1 day. So we can see here this date of service was January 12th, 2022. Now, for perspective, today is January 27th, 2022. So the second column, HCPCS, those are the procedure codes that were billed. You can see the first line item was a 97110 therapeutic exercise. You can see the GP modifier to indicate it was delivered by a physical therapist. GO would indicate occupational therapist. GN would indicate speech language pathologist. So sometimes what I'll see is a series of claims where one line item might be denied. But if you look, you would see the GP modifier on the claim line items above and below, but maybe they forgot or neglected to put the GP modifier on that line. So this is a great way for you to just kind of rehearse and practice visually very quickly. You should be able to look at this and understand everything that's going on. So we've got the number of units. You can see it was 2 units of therapeutic exercise. The number of units paid. So this particular plan paid for 2 units. You can see the charge amount listed as $150. So what that's telling you is that 2 units were billed for a total charge of $150. So you know that this particular person, this provider, was billing $75 per unit as their fee schedule. That's their charge line item. Then we can see the adjustments. Some columns will say adjustments, some columns will say discounts, contract reductions. There's different terminology, but basically, if I can read that fuzziness, it's 103, maybe 86. And so what you're seeing here is if the charge amount was 160 instead of 150. The adjustment would be 113.86 instead of 103.86. So the adjustment is just going to reflect the difference between the charge amount and the allowed amount. If the charge amount is higher, the adjustment amount will be higher. If the charge amount is lower, the adjustment amount will be lower. As long as the provider is charging more than the allowed amount, there's always going to be a number in the adjustment column. And a common question I get is, are the adjustments something that you can write off on your taxes? And the reality is, no, it is not, because all of you are likely using what's called a cash-based accounting system, meaning you only pay tax on the money you actually receive. You're not paying taxes on the money you bill. So since you never received the 103.86, it's not deductible on your taxes. Okay, patient responsive or allowed amount is next. You can see 4614. You can see patient responsibility is 4614. So if we do a little bit of math, now the math isn't going to be quite as easy as you might think. You might think, well, 2 units were billed, 4614 were allowed. If I divide 4614 by 2, I would get the total allowed per unit from this particular payer. The problem is, if we skip ahead and we look over at the adjustment codes, reason codes, you see that column there, it says CO59. CO59 is the reason code for MPPR, the multiple procedure reduction. And just looking at this claim kind of overall, we can see there was an evaluation line item, 2 units of exercise, 1 unit of neuro-rehab, and 1 unit of gait training. So we know that MPPR was applied to this particular line item. It's not necessarily reflected here, but we know that the reason code is there. That's why I like to get a copy of either the original paper EOB if possible, or a more detailed breakdown to see exactly where MPPR is, so I can better understand that. But anyway, for right now, we can say the patient responsibility was $46.14. What was paid to the provider was $0. Looking at this, what this tells me is that the $46.14 likely was applied to the patient deductible. And if you look down the column of patient responsibility and allowed amount, you can see every one of those match exactly. So the $100.64 matches, the $26.26 matches, the $23.07 matches. The total patient responsibility down at the bottom is $196.11. We know that the Medicare deductible for 2022 is $233. So at this point, we get a lot of information. We can see what the allowed amounts were. We can see what the patient responsibility is. We can see that this payer, Medicare, did not pay anything to the provider, but the balances were applied to the patient, so it's the patient's responsibility. What we don't know what the patient's supplemental is simply from this screen, or secondary if they have one. If they have a supplemental, we don't know if that supplemental is going to pick up the deductible that you see here. I've got other videos on this channel that'll tell you how to look at the supplemental chart to see which supplementals do pick up the deductible, which don't. We don't know if this patient even has a secondary. Obviously, this isn't my patient. I've asked for this screenshot so I can review it with anybody who wants to learn how to read an EOB. All we know right now is, as of this one date of service, we know that the charges are being applied to the patient responsibility, which suggests to me that the deductible has not been met. The fact that no payment is going to the provider yet would indicate that there might still be more that has to get applied to the deductible. If I, as a provider, haven't checked this patient's secondary coverage, I don't know that I would necessarily want to collect any of the 196.11 right now, because the secondary might come in and pick up. Now, you should have internal policies. You should have procedures established to make these determinations ahead of time, so that you could explain to the patient upon arrival or before they schedule the initial eval, we've called and verified your coverage. At this time, your Medicare deductible has not been met. We called and checked your secondary. Your secondary has stated that, whatever it's going to be. You want to give that patient as clear of a picture of what's going to happen financially as possible. And of course, this plays into the good faith estimate information that's coming out this year. But even before that, as long as I've had a practice since 2002, 20 years of patient and practice history, we've always tried to give the patient the absolute worst case scenario from a monetary responsibility perspective, because we want them to know, hey, this is the most it's possibly going to cost. It might cost less. If it costs less, we'll refund you the balance, but this is the most that it's going to cost you. And we get those numbers based on what the insurance quotes us, on past history of dealing with that particular insurance payer, and our own internal systems that help us predict what the patient might owe as an out-of-pocket cost. So guys, I hope that information gives you some nuggets that help you get through the beginning of any calendar year when deductibles reset and you're not sure what to collect. But if you have specific questions about reading EOBs or insurance terminology, please feel free to post them down in the comments, and I will catch you guys on the next video.